Good morning, all. Today, going to discuss goniometer. Okay, let us see what is the definition of the goniometer. A goniometer is an instrument used to do the physiotherapy and orthopedic to measure the range of motion of the joint. It helps assess to flexibility, joint function, and progress during rehabilitation. Okay, what is the defin definition of the goniometer is a tool is a measurement tool to measure the joint range of motion. It helps to assess flexibility, joint function, and progress during the rehabilitation. Okay, let us see the part of the goniometer. Then fulcrum, then standard arm and movable arm, and the scale or protector. The fulcrum is a central point, is placed over the joint axis, act as a pivot point to moment the measurement. For example, we can measure the elbow flexion extension. The goniometric point, the axis of the goniometer is a lateral epicondyle. We can measure the elbow flexion extension position in the high sitting or the supine lying position. We can keep it the hand over the couch in a resting position. We can place the goniometer axis in the lateral epicondyle to measure the elbow flexion. Then stationary arm, fixed arm aligned to non-moving body part to the proximal segment. It's a standard arm. There it is a fixed one. We can place it over the opposite angle of the movable arm. Then third one part is the movable arm, moves with the moving body part to the distal segment. In which action we want to measure, we can place it in the horizontally or vertically to place the movable arm. Ask the patient to do it the moment we can move the movable arm to measure the range of motion, how much it is. Then final one is the scale. Scale means measurement. We can call the protector also. Mark the degree 0 to 360. Measure the angle to the movement. There it is mentioned the 360 degree. We measure the joint range of motion. Ask the patient to do it the moment. How much it is the range we can measure through the scale. Then types are, what are the types in a goniometer? It's a universal goniometer. Most common type has circular protector with two arms, used for most large joint in shoulder, elbow, knee. The universal goniometer is a common type. We can use it the same one. Then other goniometer, finger small goniometer, is a small size used for the fingers and the toes joint. It's a small one. It will be helpful to measure the small joint. It looks like the small. Then Inclinometer is measure joint angle using gravity. Then commonly used to spine and the neck movement. Then digital goniometer. Then electronic version that gives digital reading, offers more precision to the data storage. It's a digital goniometer. We can measure the points in digitally, then offer more the precision data to store it. How much it is we can measure in the previous time, and we can measure the right time, the storage, the data storage in the digital goniometer. Then fluid or bubble goniometer used to fluid lever to measure angle based by gravity. Useful to the spine measurement. Useful to the spine measurement. Then procedure to measure joint range of motion. What is the procedure to use the goniometer? Explain the procedure to the patient. First, we should explain the patient what is going to do, in which joint we want to measure, for what purpose we want to do it. Everything we convey to the patient, explain to the patient, position the patient properly for the specified joint. It's important to position the patient in which joint we want to measure, keep it in the resting position. So we will get to the accurate the range of motion. Locate the bony landmark for the axis alignment. Locate the bony landmark for the axis alignment. Then align. We can set the position to which joint we want to measure to perfectly keep it the joint. We can measure it, align the joint and measure it to fulcrum over the joint in axis. Okay, we can fix the point, that is fulcrum, in which joint we can place it the axis. Then stationary arm parallel to the proximal segment. We can keep it the stationary arm to right angle to the movable arm parallel to the digital segment. Where it's done in the action, we can place it to the movable arm to digital segment. Move the joint through its full range. We can measure, when we measure through goniometer, we will get to the maximum range of motion. Read and record the degree of movement. Then compare with the normal range of motion value or the opposite limb. Compare with the normal range of motion values or the opposite limb. For example, joint movement is a normal range of motion. We will take it in the shoulder flexion 0 to 180 degree. Then elbow flexion 0 to 150 degree. Hip flexion 0 to 120 degree. Knee flexion 0 to 135 degree. Angle dorsiflexion 20 degree. 0 degree to 20 degree. Spine flexion lumbar 0 to 90 degree. These are the example normal range of motion in the joint. Okay, look at this picture. it shows the goniometer in measure on the knee joint, knee flexion in a prone lying position over the cot. The patient, we can place it the axis of the goniometer lateral part or lateral border of the knee joint. The stable arm, keep it in the straight angle of the lateral border of the tibia, lateral part of the leg. The movable arm, we can move it, get to the range of motion, we can move it through the action. Okay, look at this picture, could you understand? Okay, this is already we have discussed. This is the goniometer. It's source in the three universal goniometer. First one is full circle, there is a 360 degree. Second one is 180 degree, 90 plus 90, 180 degree. Then third one is small one, we can measure to finger and the toes. We can use it. This one is a universal type of goniometer. The center part, there it is a it shows in a yellow color, that is a fulcrum axis. There it is a half circle is a protector. It's mentioned in the range or the point 0 to 180. Then we can place it the stable and movable arm. Stable arm is stable, is movable arm, we can move it to the action. Okay, could you understand? Okay, let us move next. Okay, what are the contraindications? Goniometer measure should not be performed in these conditions. What are the contraindications? We should not use the goniometer measurement. Recent fracture and dislocation. Whether it is a fracture in recently and dislocated, measuring moment may be disturb the healing and displace the fracture site. There is a chance to disturb the healing process, moreover to displacement of the fracture site. So no need to measure these kind of the conditions. Then immediately after surgery, when we do it the surgery right now, the post-operative joints and soft tissues should not be moved until cleared by the surgeon. It's a fresh surgery, is done in recently. The soft tissue should not move. If there it is moved, it takes time to the healing process. So until clear by the surgeon's advice. Acute inflammation and infection movement may worsen the pain, swelling or the tissue damage. Then severe pain. Pain during measurement may indicate the tissue injury or inflammation. The pain indicate there it is a injury or the inflammation. Avoid to prevent aggravation. In that time, we can measure the goniometric range of motion. It will be disturb the injury and the inflammation to aggravate the pain. Unstable joint in case like severe ligament injury and joint subluxation, movement can cause further instability. Okay. Then deep vein thrombosis, movement can dislodge and clot, cause to embolism. So movement can dislodge, there it is clotting will lock, there it is circulation. So it should be avoided the deep vein thrombosis also. Then precautions, care to the supervision when we do it, the goniometry measurement, care and the supervision. Then osteoporosis and the fragile bones, handle joint gently to avoid the fracture. Already there it is a weakness in the bones, there is a chance to get the fracture, so we can handle it very gently and carefully. Then muscle spasm or contracture, move slowly and only with the pain-free range. If there is a muscle tightness or the contracture, joint structure is a stiffness in the joint structure, move slowly and only with the pain-free range. The post-traumatic conditions, check for healing states before moving the joint. Post-trauma condition, check the healing status before moving the, before that to measure. We can confirm the healing status, after that we will measure. Then cardiopulmonary and neurological conditions, avoid to excessive stress and fatigue during the movement. So cardiopulmonary neurological conditions to avoid excessive stress and the fatigue. Elderly and weak patient, the old age patients we should avoid it. If we need, we want to give it the proper support and the comfort, ensure the joint is well stabilized. After that we can start and measure the range of motion. Open wounds or skin lesions, avoid contact and pressure near the affected area, prevent the infection. Is there is a open wound and a skin lesion, is there is a skin conditions, in any skin infection, we can place it over the goniometer, there is a chance to spread the infection. So in an open wound we can place it over the part, we will give it the pressure near the area, so it will start the pain and increase the wound lesion. So these are the conditions and contraindications to should avoid the goniometric measurement. Then what are the uses? What is the uses to measure the goniometer? To evaluate joint flexibility and movement limitation. We can find out the joint flexibility and movement limitation, how much there it is, that it is a normal range of motion, is there any limitation, we can find out. To track rehabilitation progress, to track the rehabilitation progress. To track rehabilitation progress, when we give the treatment regarding the uses, regarding the conditions, we will check the progression. When we start the treatment, we would measure the range of motion. After that week or the month, we can measure it, what are the changes, how much rate it's increased, there is a stable, we can compare for that to assess post-surgical recovery. After that, the surgery is a limitation of the movement, so we can assess the range of motion is increased after the recovery. For research and the documentation in physiotherapy, when we do it the research, do it the doctorate regarding these subject topics, it will be helpful to research and documentation of the physiotherapy. It will be helpful to measure the joints, range of motion and the flexibility and the movement limitation. These kind of the related to the topic we have taken. It's very useful to do it the documentation. So we have discussed in the goniometer. What is goniometer? It's a defined goniometer. The goniometer is an instrument used to the physiotherapy and orthopedic to measure the range of motion of joint. It helps to assess flexibility, joint function and progress during the rehabilitation. Then part of the goniometer, what are the parts? Fulcrum and stationary arm and movable arm, scale or protector. Then types of goniometers. This is a universal goniometer. Right now we are using the universal goniometer. There is finger goniometer and universal goniometer. We can use the major joints. Finger goniometer we will use fingers and the toes. In small joint we will use this goniometer. Then inclinometer, then digital goniometer, then fluid goniometer. Then we have discussed the procedure measuring the joint range of motion. What are the procedure? Explain the procedure to the patient. Position the patient properly for the specific joint. Located the bony landmark to axis alignment. Then align the fulcrum over the joint. Stationary arm parallel to the proximal segment. Movable arm parallel to the distal segment. Then move the joint through its full range. Read and record degree movement. Compare with the normal range of motion and opposite limb. So this slide we can see it. So for some example, we have mentioned here shoulder flexion, elbow flexion, hip flexion, knee flexion, angle dorsal flexion. What are the normal ranges in the action? This picture shows knee joint flexion, how they can do it. It shows clearly. Then this is the universal goniometer. It's three different types. One is 360-degree type, one 180. Another one is a small goniometer to use the fingers and toes. Then contraindications to avoid to measurement should not be performed in these conditions. Recently fracture dislocation, immediately after surgery, acute inflammation and infection, severe pain, unstable joint, deep vein thrombosis. Okay, Then final one, there it is a precautions can be done but the care and the supervision. Osteoporosis, muscle spasm and contraction, post-trauma condition, cardiopulmonary and neurological condition, elderly patient, open wound and skin. Finally, we will see the uses. What is the uses to measure the joint range of motion through the goniometer? To evaluate joints flexibility and movement limitation, to track the rehabilitation progress, to assess the post-surgical recovery, for research and documentation in physiotherapy. These are the major uses to do it the goniometric measurement. Okay, we have discussed the goniometer measurement, how we can measure, uses of the goniometer, the contraindication of goniometer, then precautions, then types of goniometer. Then we have explained there it is a picture shows how we can measure. So we have discussed all things related to the goniometer. You just go through your textbook and read it elaborately, and we will gain the knowledge more from the books from that. Thank you all.